what to expect of the times and seasons, brothers and sisters.
Question that I posed to Austin Goolsbee.
Mr. Goolsbee.
Mr. Goolsbee
is my economist.
Your economist, who actually called me, thanks to Reed. He called me from London, and my question is this, and I don't want to give away the ending, but he couldn't answer it really. So you're getting a chance.
It's my job. Absolutely.
It has to do with your health care plan.
Right.
You are the only Democrat with a serious health plan that doesn't have a mandate in it, and you're kind of proud of that. And I've heard you talk about it.
Yeah.
My question is, how do you're going to have a mandate on the insurers, if I understand correctly, right? They're going to have to sell me insurance.
Yes.
Okay. Now, can I just wait till I get good and sick and then go buy it, or if there's no mandate, what is going to stop me and millions of other people from just gaming the system?
Well, I don't think people are strategic in that way, first of all, in the sense that most people want health care. The reason they don't have it is they can't afford it. I haven't ruled out a mandate somewhere in the future. What I don't want to do is set up a set of false expectations where we say we've achieved universal coverage because we've set up a mandate, but people can't buy the coverage. So there's stories percolating out of Massachusetts already where they had already exempted a certain number of people. Now it turns out that you've got another 20% of the uninsured who simply can't afford it. They're fining them $200, I think, right now. Mm-hmm. But the premium is $2,000. So, you know.
Well, the solution there would be, I would assume, to increase the subsidies if you can afford it.
If you can afford it.
But there are two ways that you can not get health insurance in this country. One is you can't afford it, and another is they won't sell it to you.
Yes.
Because you're sick.
Right.
Okay.
I know something about that because my mother, had got cancer and she died at 53, and then because she had just gotten a new job, the insurance company suggested that this might be a pre-existing condition.
Yeah.
So, look, here's my point: is that the primary barrier, I think, right now to getting health care is some of the insurance company practices and denials of claims and affordability. People don't have it. Economists will argue, and I think in the abstract they're right about this, that you probably have a cohort of healthy individuals who have opted out of getting insurance just because they're young, they think they're indestructible, they don't think they'll need it, and they'd rather spend the money on something else. But I think that we will be more effective in being able to round those folks up if we can say, here's a product that we know people can afford, and people are not being excluded. And so we built the structure in order to make sure that everybody has access to good coverage. And then I'm open, absolutely, to trying to round up the stragglers.
But if you get elected next year, and then the year after that, you're putting some sort of plan before the Congress, which you've got to convince them that it makes sense.
Right.
And there are a lot of people in the Congress, as I'm sure you know, who are much more concerned about the health of the insurance industry than they are you and me. You're going to have to persuade them that somehow this is going to work.
Yep.
And if I can delay my pre-existing condition until I'm sick, and then walk in and say, I've got AIDS, or I need a bypass operation, please give me insurance, they won't buy that, will they?
Well, look, I don't believe that any of the health care plans that are out there right now are what the actual health care plan is exactly going to look like when it's passed. Mm-hmm. There are going to be a series of negotiations and a series of decisions that we're going to have to make. We're also going to have some budgetary constraints. What I've said is that I think we can achieve about $100 to $150 billion worth of savings instituting my plan that we then use to make sure that people have coverage and to provide these subsidies. I'm also committed to rolling back the Bush tax cuts on the top 1%. But I'm going to have to make a series of decisions, and along with my congressional counterparts, about what system is going to work best. And it may be that If we set up the system in the first term and we still have a significant number of people who don't have health insurance, that I'm open to saying, for example, that there's a trigger. A certain number of people continue not to have health insurance, that triggers automatically within the law the institution of some sort of mandate. I'm happy to explore those options. The simple point that I don't want to create is a situation where you've got, we say there's a mandate, people have to purchase it, but frankly, they don't have the money to purchase it. And then we've created a bunch of outlaws out of people who would love to have health care coverage but don't have it. And an interesting contrast is between New Hampshire and California. New Hampshire doesn't have a mandate for auto insurance, but has one of the highest rates of people with auto insurance in the country. California has a mandate, and it's estimated about 17% of the people don't. What's the difference? Well, the difference is because people in California can't afford it.
Well, okay, but New Hampshire won't sell health insurance to my wife, and under your administration, it will.
They will have to.
They will have to. Okay. And have you? This last question on this issue, but have you given some thought as to how you're going to get this through, whatever it is that you come up with in the final shape?
What's the political process?
Yeah,
absolutely.
Because it's maddening.
Well, look, I think we can take a lesson from 1993. I actually give Senator Clinton and Bill Clinton credit for having tried to deal with this issue. I think they made a mistake in how they went about it, and this was the mistake. They essentially went behind closed doors. They got their team together, our magazine, and everybody got in. They shut the door. They excluded even congressional allies like Bill Bradley from participating in the plan formation. As they were huddling behind closed doors, the insurance industry was mobilizing, and they already had those Harry and Louise spots up. The plan was DOA by the time they released it. So what I've said is this: we're going to set up a table just like this, a little bigger, and we'll have doctors, nurses, and hospital administrators, patient rights advocates, employers, labor. Drug and insurance companies will have a seat at the table. They just won't be able to buy every single chair. And we will have a public process for forming this plan. It'll be televised on C-SPAN. I can't guarantee it'll be exciting, so not everybody is going to be watching it. But it will be transparent and accountable to the American people, so that what happens then is you've got the chairman of some committee somewhere who starts pontificating about how, well, the drug companies have to be able to charge what they charge for research and development. I, as president, will say, well, let's bring in some healthcare economists and experts to see, is that in fact a valid argument? And they will then present the facts, where it turns out that what's called R&D often includes TV ads and inducements for doctors and so forth. And so the point is that in a transparent process like that, where the American people are being instructed about the choices that have to be made, then that diminishes the power of lobbyists. And it's not that they won't have any influence, they'll still have some, but it serves as a counterweight. And one of my jobs as the president will be to guide this process so that it's an honest process, and that the American people know, look, the drug companies, insurance companies are two of the most profitable operations out there, and here's the reason why, and we can change it and they'll still be making a profit, but you will now have options that don't bankrupt your family. I feel confident that members of Congress, when they're confronted with a public that is actually informed about this issue.
I warned you. I prepared you. I instructed you. I told you what to expect of the times and